coming. We are in a public meeting, so we are recording. And what that means is that recording is posted publicly. The public is welcome to be part of this meeting. We really encourage it in these work sessions because this group here is a working group, and we're pulling together by the end of today. Our goal is to pull together some recommendations to the appointed members of the Community Health Advisory Council, where then it will be considered in that space for approval, or if they want to make changes as a whole group, they have the ability to do that in that next regular public meeting. So there is public comment in this space. We welcome it. I think the majority, but not all of us, are appointed CHEC members. So thank you all for being here. We do have some staff in the room as well, and we're going to do roll call first. And I'm going to have Alex, she's scrolling so that I am able to go through our appointed members. When I call your name, please let folks know that you are here. We will likely have to project because folks online are only hearing through this, through Alex's laptop.
So direct your sound here.
But like April said, it's going to get better as we continue having these meetings in here, and we'll have a better sound setup next go around. So that being said, I'm going to go through appointed members. Katie Plum, I'm here. April.
Here.
Ladell.
Here.
Courtney.
Here.
Devin.
Here.
Hope.
Here.
Audra.
Here.
Erica. Grant. Bill. I know Tom's not here. Kimberly. Alrighty. Thank you for our official roll. And we'll do introductions next. So we'll go through all of us, share your name, who you're representing. It could be the community, it could be an organization, and your title, if you would like to share your title, just so everybody has a sense of who's contributing to today's meeting. And we'll start in the room and then we'll go to folks online. Alex, do you want to start first?
Yep. I'm Alex Greenberg. I'm a health programs coordinator for Kirk County Health and Human Services. And then I do mental health and suicide prevention, tobacco prevention, and alcohol and other drug prevention.
All the things.
Yeah.
Hope Porterfield, owner and therapist at M3 Alliance.
I'm Stephanie O'Neill. I am the Public Health Modernization Manager for Kirk County Health Department, Kirk County Health and Human Services. I supervise the prevention health promotion team, emergency preparedness and response, and environmental health.
Look at her. She didn't even have notes for that.
I was looking down. How do you know?
You're focused.
Ladell Harris, community member.
Todd Oliver, community member, badly outclassed by most of you, so.
No. I doubt it.
April Hong, clinic manager at Prineville Mosaic. Haley Morris, overdose prevention coordinator for Kirk County Health Department.
I'm gonna take a quick pulse check online if you all were able to hear introductions. Okay.
Yes.
All right. Wonderful. I'm Katie Plum. I am the Health and Human Services Director, and I get to chair the Community Health Advisory Council with you all. Let's go online. Courtney, are you able to go first?
I am Courtney Peressa, primarily here as a community member, but also work for outpatient rehab at St. Charles, specializing in women's health and infant development.
Welcome.
Parisa.
Angela.
Angela Cumming, I'm the program director for Best Care in Crook County. We're the contracted community mental health program.
I'm Angela. And Greg.
Greg Marquardt, Community Benefit Specialist for St. Charles and Madras, Warm Springs, Redmond, and Prineville.
You can make it. Devin.
Hi, Devin Nelson Harmon. I'm the Programs and Community Manager for NAMI Central Oregon.
And Rita.
Hi, I'm Rita Roden, the Perinatal Care Coordinator at Crook County Health Department and also Community Health Worker.
Welcome. Glad you could join us today. Alrighty, let's do this. So this is meeting 2 in a series of 2. So we met
January.
in January. So it's been a little bit since we had this working session. We did have a regular meeting between there, but we're going to dive back into where we left off in our meeting in January, but not everybody was here in January. And I don't know about any of you, but sometimes it's hard to think back that far and remember what we even talked about in January. We're now in March, folks. That's too long for me to remember details anyway, although I did have the luxury of going over some notes in planning for this meeting. So we're going to start with a recap, and if I can navigate to my presentation, excellent. So one of the things that we did in January was we talked through our vision for what we want our community to look like, feel like, function like. And we did some detailed work around, we talked about our dreams for the community. We talked about some of the issues we're facing. So to start with, and I talked about this in our January meeting, is it's so easy when we're doing planning in this space to get caught up in what all is wrong and the problems that we're tackling, the problems that feel too big. And so I want us to root ourselves again today in what we're aspiring to, what we want to see, and then we'll dive into the problems and how we're going to fix them all.
I don't know about all. You have a limited capability.
All right. Alex keeps me in check. We're gonna do good. We're gonna do good things though.
The dreams are for the vision and the mission, our actual goals.
Yes. Hang on to them. Okay, so we're gonna start with our vision and a vision statement for groups, and hopefully this will get easier because as we didn't have a vision and mission before, so we're writing this from scratch. When we do this again in another couple years, we'll be able to look at what we have and just amend if needed. Otherwise, we can keep it and not go into these weeds again unless necessary. So we're in the vision weeds a little bit, but we pre-drafted some options for you all to consider. So I'd like you to read through them for our folks online. They're on a screen. If anybody doesn't have the ability to see on your screen right now, let us know and we can, well, the vision and mission documents were in the meeting packet, so those should be in your meeting invite or in your email, but let us know if you're having trouble getting to those documents and if you don't have the ability to read through the vision statement options. So read through, digest, and we will discuss. Oh. Probably. We're getting pens in the room, so if you're online and you need to snag a pen right now or type.
I'll
feel
throw
free.
it through the computer.
All right, I'm gonna start real broad with my questions as we work through this. I am wondering if there's anything that feels right about these options. What feels right or sounds right?
I think option one sounds more. I don't know the correct word for it, so I'm just gonna say professional. It sounds more, well, like it says, balanced, formal, and community centered. I mean, it sounds,
That's more inclusive.
yeah, yeah, it's broader. Yeah.
Okay,
Devin online has something.
Devin, go ahead.
Yeah, my take on it.
Yeah, I was
Hold on,
gonna say
Devin.
that, oh,
That was just omit some things.
The option 2 on the worksheet, the bottom option on the screen, I know you guys can't see the screen, sorry. So the one that starts with a community where partners are united. Audrey, you're saying that feels like it might be leaving some things out?
No, what's nice about it is this succinctness
Oh, I see.
that, you know, as expressed, it may be a little too succinct.
Okay, all right. Devin, go ahead online.
yeah, I was actually just gonna second the opinion for option 1. I feel like I like it. It's a little bit more clean in the wording, and clear. And I think it like really succinctly encompasses everything we want to say.
Okay. And Courtney?
I'm here for another vote for option 1. To me, when I first read it, it felt more person community emphasized over partner community emphasized.
Okay. Anything that you would like to, because we can take parts of one and add it to another if another is lacking. So is there something that you'd like to swap around or add or take away?
I think on option 1, what grabs me is a healthy, connected community. Like that, I like that. Like that grabs me right there. I want to be part of a healthy, connected.
Yes, and being our vision, I think that is a great way to
Yeah.
start out a statement.
Yeah, I also like in option 1, the word achieve, because, option 2, like it says, I think part of option 2 that isn't hitting for me is the basic needs are met. And then the other part that says individuals and families feel safe, because I think those two things are very objective and can be hard to kind of determine fully.
Okay, so what I'd like for us as a group to be able to do with everything where we're getting to a point where we feel comfortable in making a recommendation to the appointed members is that we have consensus as much as possible. We're not voting on anything in this meeting again, but I'd really like us to get to a place where nobody has heartburn over something that we're putting forth. So I'm hearing a lot of support for option 1. Am I good with that?
Everyone online.
And is there anything that we would change?
Thumbs up from Courtney.
Okay. speak now or at least hold your peace until the next
Devin likes
advisory meeting.
Devin likes option one just the way it is.
Right, lovely. I haven't heard from Rita, Angela, or Greg, and I don't necessarily have to unless you have something that you would like
Angela seconds what Devin said.
made amended. Okay. Awesome. Task one accomplished. We will bring that first option for a vision statement forward for consideration for adoption at our next meeting. Let's look at mission. These are a little bit longer, so I apologize for folks who are looking on the screen. It's a little more of a cramped slide than I typically like to put out in the world. But we have a couple options. We did a similar thing where we put a couple of options together for a mission statement, which is a bit more specific. It's meant to be a bit more specific than our vision. Give them time to digest. There's a lot of similarities. But initial thoughts.
I like the tightness of option two, but then that's sort of what my information is.
Uh-huh.
Yeah, just tighten it up and say it.
So some succinct language, a little bit more succinct, direct language in option two.
Kind of like option one, but I'd like to see the word listen put in there, like in option two, because I thought that was something that grabbed my attention in two, but also I was going back to what Stephanie said about like basic needs and how some of that can be, you know, interesting to interpret.
So like if it was added at the beginning where we bring together community voices and partners to listen to, identify, and prioritize.
Yeah. It's like right where I put my
Okay. Rita prefers option two.
Yeah, I like things about each, but option two feels, and it's funny because in the little brackets, it says more community forward. And that's what it feels like to me. The first one feels very like administrative almost.
Yeah, almost like we're working really hard to make sure we mention everything, don't leave anything out.
Mhm.
Which we have
Mhm.
now, yeah.
So our vision is what we want to see. Our mission is a little more of how we're going to do that. So do you think that we've landed on a vision? Do we think that what is described in these gives an accurate picture of how we're going to go about
I think that's
achieving our vision?
That's why I was pulled to one, because I was like, oh, that makes more sense of like, that's what we do, you know? So, but I think there's definitely strengths in both. So maybe it's a molding of it all.
Also, I am seeing my typo. It's not in the worksheet because Alex edited well, but I do have a typo in the first one for prevention. If you can ignore it, I'll now not unsee it, but here you go. Courtney, I see you have your hand up.
And then yeah.
Hey, I was trying to type and it was too hard. I was drawn more to option one, and my thought was that I felt like it gave a very clear understanding of the exact intent of the advisory council. And I liked the perspective of across the lifespan versus the specific indicator of all ages, because I feel like it's more than just all ages. It's all people, period, regardless of other factors beyond age, which is where I came more to option one.
Okay. Great. Thank you for that feedback, Courtney. Do we have some stuff in the chat too?
Devin has her hand up and wrote a
Okay.
version in the chat.
Yeah, go ahead, Devin.
Yeah, sorry. I was just kind of trying to piece together a little bit from each, I liked option 2, but it says, unites community partners to listen, identify health priorities, and I wanted the piece of also bringing together community members or voices in there, so adding that, and then there wasn't anything about like the people of Crook County. I mean, I know it is the Crook County Community Health Advisory Council, but I added some the residents of Crook County living safe, healthy, connected lives. But I also like the point Courtney made about the across the lifespan. I liked that language instead of the all ages thing as well. So I don't know. I just wrote something that needs more editing, but those are kind of my thoughts.
Devin, do you mind reading what you wrote in the chat?
Yeah, I wrote, the Crook County Community Health Advisory Council unites community members and organizations to listen, identify health priorities, and shape collaborative solutions that improve the mental and physical well-being, ensure basic needs are met, and support the residents of Crook County in living safe, healthy, connected lives.
Could you read that one more time?
Throughout their lifespan or something. I don't know.
Because
Oh, yeah. Courtney, we'll read it. We're going to read it too for the room because our audio in the room is a little quiet.
Oh, okay. Yeah, go ahead.
The Crook County Community Health Advisory Council unites community members and organizations to listen, identify health priorities, and shape collaborative solutions that improve the mental and physical well-being, ensure basic needs are met, and support residents of Crook County in living safe, healthy, connected lives. So she just added a few parts to option 2, and I've kind of been adding all of your suggestions as we go.
And one thing I heard Devin talk about that wasn't plugged in there, we removed all ages, but we like the language of across the lifespan, it sounds like.
So essentially turning the support people of all ages to support residents of Crook County across the lifespan in living safe, healthy, and connected lives.
Yeah.
Did that make sense online? Okay.
Yeah, somehow putting that in there like smoothly. But yeah, I do like that.
Great stuff.
I also reworked option 1 to make it so that I liked it better, and I'd like to share that because there was just a few things about number 2 that I really liked, and so I kind of moved them to option 1. To say Crook County Community Health Advisory Council unites community voices and partners to listen, identify, and prioritize local health needs, shape collaborative solutions, and provide informed recommendations to the Board of Commissioners that advance holistic prevention-focused solutions so that people across the lifespan in Crook County can access basic needs, responses, supports, and opportunities to thrive. So I just took a couple of things and moved them.
So we want to make sure what I heard in both of these examples, we want to make sure that both partners and organizations are identified in this mission, as well as that emphasis on community members. And my sense is that like community member forward is really important. And then we went back to lifespan and listening. Yes.
I think the Board of Commissioners part is important because I feel like number 2 as it is just too similar with the vision statement. So like 1 I like because it acts actually talks about like, what are we doing?
Yeah.
Yeah, so anybody from the community knows,
Yeah.
like, oh,
And like
That's-
who makes the final, not, you know, I mean.
Yeah.
Decisions
Right.
on where it goes.
Yeah.
Yes.
Yeah.
And that's part of our legislative requirements for this group too.
Yeah.
So it'd probably be good to have it in a mission.
But I do like how concise number 2 is, so I don't know if we can keep it actionable, but make it maybe tighter.
Yeah. Yeah.
I don't want to wordsmith this to death in this space. But so Alex has been taking notes. I know some of you have also. Are you okay with us taking these things, crafting it for it to go in front of the appointed members for approval? Okay.
Kind of combining all of that into one,
Okay.
hopefully
Thanks,
more
Devin.
succinct as the first, but all inclusive of what everyone wants. Okay.
Yep. All right. Do it. Look at us cruising. Okay, I want to dive in a little more detail that review of what we did in January. So that was a very specific part of what we talked about and what we needed to come out of this. So a refresher. Hope, do you want to take that chart, the big paper, and pass those around for a visual? We talked about our dreams for our community, and again, hopefully that is reflected in our vision. We did spend some time identifying problems that may prevent us from achieving that vision or fully achieving it, including, we dove a little bit deeper into some details of what those problems look like in our community. We talked about certain populations that might need some extra support to address those problems fully. And then we thought a bit about what do we as the Community Health Advisory Council have the influence to change? Because we could put some goals up that we can't do anything necessarily actionable as the folks in the room. So if it's like a federal issue around housing, for example, that we really dive into and decide we're going to do, we can do some legislative work as this group. But it would be up to this group to decide if that's where we want to invest our energy. Steph.
Sorry, I didn't mean to interrupt.
No, go ahead.
It shows the categories from themes from above, but is there a significance to the gray and the white?
We'll get there. Yep. Yeah, we'll get to, I know there's a chart that folks online aren't seeing, but people in the room are. It's the check, kind of the summary from work plan session 1 that was in the meeting packet. So I'm very much summarizing on the screen for our folks online what we went through. But those were kind of the big buckets. And then hope everything should be summarized on the chart that's in your meeting packet or that some folks are able to look at. If there's anything that we didn't make sure was in conversation that maybe we missed in summarizing, if you can look through those and just raise a flag if we need to add something.
And there may be spelling errors in this document. I apologize. I got sick of looking at it because there's 4 other ones I also had to look at.
I'm wondering if we can share that document.
Yeah,
share
I have it.
screen. Okay. We're gonna work on getting the document in front of folks that are online.
Yeah. All right, everyone online. This is the document we are all looking at.
You might have to zoom on your screen to make out the text.
Yes, sorry, everyone.
Or actually, Alex, you could zoom in just on those. Well,
Yeah, if you guys want me to change my screen at all, please let me know. Online. What did I do?
Sure.
I spelled something wrong.
Transpiration.
There you go. Transportation, okay?
Somewhere between transportation and inspiration.
See, that's
I'm a perspiration.
uh,
No,
Okay.
there's things on here that I kind of forgot about, and oh yeah, we did talk about that, I did, yeah.
So at
And
least
kudos to you, because there was a lot written
Yeah.
down on the walls. So
we took
mean,
pictures.
I took pictures
We-
and I had all of those big yellow papers hung up on the wall in my office. I just typed it all out.
Yeah,
was a
I mean,
lot.
it's, yeah, it's, wow, yeah. Wow, neat.
Tried to put it in a way where it could all fit onto one thing.
Yeah, that was great.
Yeah, it is.
All right, so it's seeming in the room that it's a comprehensive documentation of what we talked about. And if
No comment online
we're
yet.
not seeing anything online. So, and Alex, would you focus in online on, and for in the room, we're gonna look at the first two columns. And we'll get into what Stephanie was mentioning about the color scheme that we have. So the other columns that are in like the white and gray, that was getting into some nitty gritty that might get us into problem solving mode. So when we're looking at identifying like issues in a big bucket and summarize them, Alex and I sat down, and this is solely based on our reading through of all the things that you put up on the wall, and brainstormed in January. And we identified some themes that are there in the bottom. So the access to care is one. So everything that's in a green box, we identified as an umbrella of having those things are about accessing care and the quality of care that is being accessed. And then we have orange, that is things having to do with prevention and recovery. Blue being social drivers. And then purple having to do with community readiness. And so my question would be, did we put anything in the wrong bucket? Do those buckets make sense at all or resonate with you? Because we can retitle buckets, we can shuffle things around to other buckets. But what we're trying to get at is like a really high level issue or theme that then we would choose to dive into deeper. So I'll let us digest a bit, and then as you have thoughts, we can share as we
We'll just,
dig.
it's hard to focus on those two and see them at the same time.
I don't think this one is in the
Bree, can you
launch
just scroll
category,
down to
but
the themes one more time?
There you go, Devin. Sorry.
Go.
I know
You're
it's
good.
harder to read them, but now you can see everything.
That's okay, thanks.
Sorry, Stephanie.
Oh, it's okay. I feel like the one that says any issues in the schools, it's purple on the very bottom of the purple section. I think that one can be several of them, so like. It almost needs to be a multicolored one.
I couldn't make the boxes more than one color, but there were a few where I was like,
And actually, we didn't necessarily dig into that. I think that's something that we'd have conversations with our school folks about.
Yeah.
But I also think that that identifies a population. So it could also go into one of the white gray columns, as not necessarily a problem, but a population worth focusing on. Good.
I think the two blue ones, people knowing how to access resources and also having like a community center. I'm leaning towards those being like access related rather than social drivers. But it's other people's thoughts.
Which ones are you?
So having a community center is on the far left. And what was the other one, Haley?
People knowing / education on how to access. It's just a couple down.
Okay.
It's funny, I can see a lot of them being prevention too. But
Yeah.
that's.
Yeah.
And I think there were a few of them that we wrote down at least two options for. But again, I couldn't color everything multicolored. And it was really hard to organize them all and fit
for sure.
without it being like an even longer list because some boxes needed to be shorter and longer.
Well, and I think, one of these says like a holistic approach, so it's like, that is what we're working on, and it should probably cover multiple categories technically, so.
Sure.
So I think a community center, well, I'm gonna back up a little bit. How do you feel about the buckets, the themes? And then maybe we can go in, like, as long as we know that those are ones we could get behind, then we could kind of tease out the others.
Are you saying the colors or buckets or the
The
columns?
colors or buckets.
Okay.
Yes, thank you.
Mhm.
So how do the colored themes? So
Go.
access to care, prevention and recovery, social drivers, community readiness.
Mhm.
I don't really know any other buckets that we can use. I think those are the buckets.
And also acknowledging that there could be things that we do that address multiple.
Devin has her hand up.
Yeah. Devin, go ahead.
Is the community readiness like I feel like that's more of a like sub pillar of some of the categories. I feel like it's a barrier or problem rather than a main category, but I could be convinced otherwise if someone explains it to me.
Okay. Yeah, I agree with that too.
There's
I don't know. Any
agreement in the room.
I didn't quite hear what she said.
So,
Sorry.
so Devin was sharing that the purple community readiness items feel more like a subcategory of the other three. So access to care, prevention, recovery, and social drivers. Because all of those probably have some aspect of readiness.
Yeah, like that's just, one thing on the list of things to consider when looking at all of these other things.
Any other thoughts about the buckets? Okay, so we feel okay about, and if we look at our mission statement, if we have a focus on access to care, prevention and recovery, and social drivers, and those are social drivers of as they relate to health outcomes. Do those three things help us achieve our mission and vision?
A rough mission.
Yes. Yeah. Rough mission, clear vision. Okay. Hearing no dissent amongst us. Then I think we've talked, we've identified, you're sharing agenda.
Yeah, sorry.
Here, it would help if I just said something. Okay.
Yep.
It sounds like community center could be in prevention and recovery and social drivers. I think a community center addresses some of the social drivers of like folks not having things to do or spaces to gather as more of the problem, and the community center is the potential solution or something that would help that. Okay, and then Haley also mentioned the people knowing and having education around how to actually access care and also to have the opportunity to use resources that are already here. They just don't know about them. Okay, yes. So that could potentially be
That's what I wrote.
so it's a social, it is a social contributor, but it could also benefit access to care. I think it's totally fine that we have those in both spaces. Are there any others that feel like that or just need moved?
Well, the last meeting was that, the group seemed to feel the community center would help with a lot of issues. And I didn't do my homework to check how many other communities in this area had community centers and how they were. I reflected on my experience in Wyoming, where of course winters were a little more brutal, and the outdoor recreation in the winter was quite limited. So they were wildly successful. They were also pretty expensive. And thankfully, we do not have access to those funds because those were from mining and the great extractive industry that that state exploits. So, yeah, it's like how feasible, how the feasibility of building a community center where I could see that hopefully it would serve a lot of needs in bringing people together, exposing them to resources without stigma.
Yeah, that's fantastic input. And I think that that observation is going to help us in our conversation as we go throughout today. So we've captured it. Hey, welcome, Erica. Good to see you.
No, I don't know.
Or at least know that you're here.
Yeah, right. So yeah, finalize the topics that we want to.
Okay, so those, are we comfortable in having 3? a focus on access to care, prevention and recovery, and social drivers. Those feel like good things that the Community Health Advisory Council could address, and they relate to our mission. Lovely.
Everyone online cool with those three? Or have opposition of any kind?
Right.
Yeah. Looking good.
Okay. So we're gonna dive into these buckets then. Also, just as a quick note for folks in the room, sorry, folks online, we do have snacks. So if you're feeling a bit peckish as we go, feel free to just get up and grab something. There's also restrooms across the hallway. Folks online, do what you gotta do to take care of yourselves. Grab a purse snack or a desk snack or whatever you got handy, and we'll keep cruising. Okay, so I'm gonna pull back up my presentation for folks online. And then for folks in the room, we're gonna shift to making, we're gonna start drilling into those buckets so that they can be a bit more actionable. So we're going to talk about SMART goals or SMART objectives. We're thinking along the lines of objectives in this case, but they need to be SMART in order for us to actually act on them. So, do you have that?
These
Or
are
more?
all of the plans that are already in existence, so that people can look at them as we follow.
Okay.
their
Thank you, Alex.
Objectives, yes.
She keeps me on track. As part of our review, remember or jog your memory with some resources that were in the packet and we're handing out. We've got handouts here of some summaries of the plans that already exist in our community. So St. Charles, Central Oregon Health Council,
And us.
and Crook County Health Department have plans in place that have some overlap here and have some resources attached to them. And so those could be things that we either want to align ourselves with because we could make those efforts stronger, or we could decide that there's things that we don't want to duplicate and we could invest our energy in something else that moves us in the right direction. So as we dive deeper into what we're thinking our own plan could look like for the Community Health Advisory Council, it's good to keep in mind that there are other things happening. And it's a lot of paper and a lot of words.
And just a few notes.
So much information.
The St. Charles one is only their needs assessment, their action plan, which is not the words they use, but it didn't get finalized until, I think, Greg can correct me if I'm wrong, but it was supposed to be finalized last Friday. So I didn't have time between the end of the day Friday and this morning to draw what their actual activities are for their assessments. And then the last two documents, which you can read the titles on the top, are from the health department. They're the fair access plan. One of them is our assessment, and then one of them is our action plan and how we are planning to enact on our assessment. So just a few notes. And also probably spelling errors.
But
Sorry.
yay, cool, thanks, Alex. This is a lot of information in one spot. It's like, you go. That's awesome. Yeah.
I have a lot of bulletin boards in my office and whiteboards. And all of these were included in the packet, in the email you guys all should have got online. If for whatever reason you guys can't find them or don't have them, just let me know and I can forward you the email.
So depending on how much access folks online have to those. If you're able to get to your meeting packet and grab those, what we're hoping to get out of this kind of review of plans and assessment, and as it relates to our work in creating, another plan, is what is currently happening. We want to develop our plan in the context of things and efforts that are already happening. And now that we have 3 buckets,
Take what you would like. Yep, sorry. Six, what am I missing?
all our markers disappeared. People, where the markers go?
Erica Gray. Okay.
Or were those our markers? I found a brown. I can.
There were 1 or 2 up there, but yeah.
I don't know what.
And everyone online, I'm in the process of emailing you all the documents, so hold on just a minute.
BCHHC?
Park County Health and Human Services. Yes.
It's that broad, right?
Yes.
I'm trying to pull us out of the overwhelming. Because it is a lot, yes.
Actually,
I would encourage you, as you're looking at this information, to kind of, if you can tease out some things that are already happening related to access to care, prevention and recovery, social drivers, because we've already identified that's where we want to narrow our focus.
Oops.
We'll give some time to dig through these resources, and then we're gonna have a brainstorming discussion. Here you go.
I've almost got all the documents in the email, everyone online.
By the way. The side of the room feels orange.
The heck?
I'll jump.
Sorry.
It's okay.
RIP. St. Charles. There we go.
Shot right down her throat. Death by cutie. Yeah. It wasn't cute.
Did I get that? There we go. All right, everyone online, I'm just now sending the email. It will have the St. Charles Community Health Needs Assessment, the Central Oregon Health Council, RIP, and it's only gonna have the parts that are related to what we're doing from the RIP. And then also 2 documents from Kirk County Health and Human Services Fair Access Plan for both the assessment and then the action plan. So if anyone has questions, let us know. Everyone in here right now is just taking their time and going over the documents.
You have HC RIP, that's for all of Central Oregon, right? No.
It is, yes. But if you guys didn't hear when I just said it to the people online, I only pulled parts of the RIP that are relevant to the work we're doing. There is more to the RIP under each bucket, and I think they have a total of 6 buckets. And I only pulled the ones that were kind of relevant to what our first work session plan was. Yeah.
People, no one wants any vegetables.
I'm gonna give 3 more minutes, which I know sounds insane for the amount of information, but I don't want us to drown in information. So I'm gonna give us 3 minutes and then I'm gonna walk us through some brainstorming. Unless she's Up there, Haley. All right, just one more minute.
What were they?
Yeah. Information overload.
It's a lot.
I'm gonna pull us out of the weeds.
All right, everyone online, can you hear Katie?
Then we're gonna come out of the weeds a little bit. Feel free to reference back to these because we're gonna do some more work as we go, and the discussion that we have now is going to keep having, we're gonna keep having it for the rest of our time together. So we're gonna start it here and then keep having it. When I ask these questions, they could be things that you found in these documents, or they can be things that you've personally experienced or that you know about. So related to access to care, what are some things that people are doing in our community right now related to access to care? And what are some resources that might already exist right now? Steph.
Well, I noticed that on each plan, transportation is clearly a huge issue, specifically in our rural areas. And each one of these plans has something to do with transportation. So working on, and like some of it doesn't like explicitly say how we're gonna work on it. It just says like provide quarterly opportunities to reform and create regional, county, and community transportation policies, like some of them, they're really, really broad. And so I don't feel like in any of them that I read, there was like a real, like, this is how we're gonna hit it,
It's a shared issue, but not necessarily things either happening, or I think that there are resources around transportation in the community and things that providers are already doing. It's just identified in these bigger plans that St. Charles, Central Oregon Health Council started looking at, knowing that it's still a need. So are there resources or things that are happening already related to transportation?
I did see two things. One is mobile medicine, and then the other one that I saw was virtual appointments, which is very underutilized. I know, right?
But while we're on that topic, and again, Greg might be able to speak more to this, but I'm pretty sure in the St. Charles Community Health Needs Assessment, I don't know where it is at the moment, but when I was writing it, it actually said that the people who are participating don't tend to use them and don't tend to want to use them in rural areas.
School application for less than.
So there's certain populations that are less likely to utilize those. And I think, and I don't know if I put it in here, but I think it's specified too that for whatever reason, they tend to not want to use it for mental and behavioral health more specifically than medical health. So just to pop that in.
Especially even with the. And we do, I mean, like, because it's a. The health plan, the health, sort of community solution does cover rides, so that is one thing that is helping when people get places. It isn't an actual vehicle, but. It pays for it at least, or a family member to tell you. That's a big source, others that. In one of that mosaic will get gas cards if you. We also know that that's super a lot, so you don't have to be taking advantage of. I'm gonna give out gas cards and take.
Anyone online have anything they want to add for resources already available or issues with resources for access to care?
I'll speak on that. This is Rita.
Hi, Rita.
Hi. I have clients that use Motive Care. I don't think it's seamless and I do find it difficult to get set up.
Rita, is Motive Care specific to the issue of transportation?
Yeah.
Okay, great.
So that's the app, that anybody on OHP can use to get a ride or request a ride. It can be like a reimbursement if they have like somebody driving them or to have access to transportation. It just doesn't seem to be like a seamless process, and it seems to be something that, every meeting that I go to with OHP that they're still trying just to figure out how to make it easier. So I find a lot of like my prenatal clients don't end up following through with using it, especially when they have to go to like Bend or Redmond for an appointment.
Do you guys know if they pick people up from anywhere, like people who live out in Paulina or up Juniper Canyon to take them to appointments? Like I'm more so like April and people who.
I'm unsure about Paulina. I'm assuming Juniper Canyon.
Okay.
There's some of the people who live really off the grid up Juniper Canyon, they won't go down some of those roads, so they do have to.
Meet them at a certain point.
They're so
Rough.
potholy, bumpy, really hard. And we've had a few patients with behavior issues, they're like, no, we will no longer, so.
Okay.
That's definitely something that impedes it.
Okay. Which is out of our control at
Yep,
that point.
completely out of
Yeah.
our control.
Mhm.
Even when you tell them.
Well, and I know that, we have the bus that goes from here to Redmond, but I've talked to several people about the potential of using the bus, and there seems to be some stigma around it, and I don't really know what it is, but a lot of people that I've talked to have been like, I'm not gonna take bus. So, I don't know what that is.
The COIC.
Or C-
I don't know.
CET.
Cascade Transit.
I wanna say houses people from already agree on that, but they have to limit their on what they're carrying with them, right? Sure. You can't bring your whole house.
Theoretically, if they needed it for like appointments,
Uh-huh.
they could take themselves and a bag.
But most people who are houseless have.
Take everything with
the
them.
ability to get to someplace in the time, so.
Yeah.
Well, that's
They
the
just
other
vote.
thing with that, transit is it's very limited, like, times that it goes.
Yeah.
Do you have something to share, Courtney?
Oh, sorry. I I tried to talk and then
You're good.
so my experience is a little bit niche. But I was thinking like our problems that we see with CET is the timing. Like people have to arrive an hour early and stay an hour late. Or have to have it's cut early because of how rides are coordinated.
Okay.
We
That
also
makes
have this like in the middle gap where people who don't qualify for state aids, they're not on like OHP or Resource Community Solutions, but they don't have the means to get their own rides.
Yeah. We could probably spend all day on transportation. So I'm gonna pull us out of that a little bit and see if there's any other things that are being talked about related to access to care. And that there are either things already happening or resources available to improve access to care. We also, I mean, we talked about virtual med and mobile med.
I've got something.
Yeah,
So,
Angela.
So as far as like mental health and addiction services go, I mean, we offer here at Best Care same day assessments to get people into services rapidly. One of the barriers that I see though in the county is, as the CMHP, our priority population has to be the highest acuity individuals. And it's kind of like if we had to triage, those are the people that are our priority population, and kind of lower acuity folks would be, I mean, I hate to say it, but kind of secondary, right? And one of the things that we encounter is there really is nowhere else to send people. When we have tried to step people down from the CMHP who kind of don't need our level of care anymore, or there have been times that people have come in and they've been kind of low need, trying to get people into other providers in this community is nearly impossible. And I mean, I can think of, we just encountered something a week or two ago. We had a conflict of interest with a youth that came in, simply because, I mean, I can't go into, but anyway, it was a conflict for us to serve this youth, but this youth needed to be served. And we called, I think, it was like 8 to 10. I mean, no less than 8 for sure. Private practitioners and other agencies in the community, and nobody was taking new clients. Or we were able, thankfully, to get this youth into Rimrock, but the original plan was that it was going to be telehealth only. They were able to make some arrangements for it to not be, but that's really challenging for us. So we're sort of expected to absorb everybody because everyone else can put caps on caseloads. And I think that that's a pretty big barrier to access to care in this community.
Devin, did you have something you wanted to say?
No.
Okay. I just saw your hand was up for a minute.
Yeah, it was a fleeting thought. It's not important.
Okay.
So I don't know if that's something that this group wants to look at, is how, how do we ensure that the whole community can get the access? Because like, I mean, at the end of the day, we're sort of accepted to absorb everybody, and sometimes we can't absorb everybody.
I think that's gonna get complicated with like how people's access to healthcare will be, and also the changes with like OHA, OHP, and allowing individuals to go see people that are not at a COA. And so I think that it is a challenge though, and there's not very many of us private practice clinicians around here, and if they are, they're mostly full. So yeah, it would be nice to see more clinicians that can take more people.
Oh, what's a COA?
A certificate of approval, sorry.
Thank you.
Does the Rimrock Arts program fill that gap, or is that not something that in that situation could have been sent to school.
Angela, did you hear that?
Sort of. I heard,
Haley was just asking if in that situation for maybe more of those lower levels or conflict of interest, if the Rimrock ARC program could fill that gap at all now that it's started.
I mean, possibly, isn't that more SUD focus? And
I don't think so.
No.
I think it's co-occurring.
I think it's co-occurring. Yeah.
okay. So I mean, possibly, I mean, like I said, I mean, when we reached out to Rimrock and we were ultimately able to get that, you know, to get that person in, well, they were willing to accept them. Whether or not that person chose to go there, I'm not sure.
Yeah.
But they were willing to accept them. And so I'm assuming that when I was speaking with the folks over at Rimrock that, that they were probably considering all of the services that they would, you know, where could we potentially kind of step in here?
That makes sense.
Okay, I'm gonna steer us
Oh, yeah.
a bit. Prevention and recovery. What's currently happening around prevention and recovery? And let's try to focus in for this piece of the conversation on what is currently happening, not what we need to happen. I have prevention staff in the room. And recovery staff.
Well, every one of the organizations does some sort of tobacco association. I know we have a pretty good MET program even in the jails and stuff, so I mean, like, we are doing really well. I think offering those kind of services, Mosaic and Best Care, both will help with anybody needing those. You know, both of those resources are really well.
Youth prevention, programs, so like our Spark Club, youth liaisons. You know, there's like other ones, but those are the ones I know about.
So Spark is a student group that convenes at both Crook County High School and Pioneer, with an emphasis on prevention.
Isn't there, I saw the thing about the, oh, no, I'm looking at the wrong spot, but there's like a program in the school where kids can get introduced to healthcare, careers. Isn't that kind of going?
Their career, technical education.
Yeah.
St. Charles one.
I thought I saw it and then I lost it.
There's also COIC has a pathway now from high school and the CTE programs into COCC and can transition to a transfer degree for public health specifically, which encompasses nursing, disease investigation, and emergency response.
And Devin said NAMI's peer support group and family support group, which I wanted to chime in that they are getting more groups going. So yay, Devin.
Yeah.
And Devin also said Haley's Recovery Run Club.
I think for how small our community is, we do have a lot of recovery-based resources.
Yeah.
And there's also Rebels Roost that has all that. There's Celebrate Recovery.
There's more than there used to be.
Yeah. And Courtney, what would you like to
Hey, this
say?
is not exact, but St. Charles now does have an internal trauma-informed care education series that every caregiver has the access to take if they want to.
That kind of contributes to both access to care and prevention and recovery.
Mm-hmm.
Yeah, Courtney, would you agree?
I
Or
do.
social drivers too.
Yeah, I do. It does have some limitations, but I have inquired with our development team to see if they can change it up a bit in order to make it more attractive to get more people taking the class and getting certified through it.
I missed some in the recovery. But
I just think I feel like with the prevention and recovery too, like all of these outside organizations are doing a really good job of having case conferences and stuff and learning. Like I know that I said, met with Mosaic, we
Yeah.
met with Best Care, we met with St. Charles and different things that have came across and how can we do better. So I do think this community is really focused on how can we do better. How can we have done better? for this
And
patient.
really working
And
together.
they really are,
Yeah.
doing a really good job of that.
Very collaborative.
Something that I'm noticing is, we're talking about prevention and recovery and all of that is mostly recovery. And I know that there is prevention, but, wondering if it needs to be called out that there's more recovery than prevention. Or maybe we're just not capturing it.
I know the schools have a lens of,
Devin chimed
Programs
in
that they bring
out
every
and
year.
said recovery is also relapse prevention. So
Right.
to add to that. And then Angela said we also have our wellness and recovery group for folks who have significant clean time and are more in of a maintenance stage. Sorry, just chiming those in real quick.
Problem this one?
Yeah.
Yeah.
Well, and from a prevention side, Angela could speak to this. I don't know, but I had heard that they're doing like a teen hangout or something like that, or I don't know.
Last I heard it hadn't, they were working on it,
Mhm.
but Angela again can probably speak
Yeah.
more.
Well, I mean, I'll also say
That feels
like
preventative.
Kurt County schools are big in sports,
Mhm.
4-H, FFA, those things, so. I don't know if we wanna call that out on here, but those are prevention.
Mhm.
Well, if we're gonna bring that up, I will also bring up in our Spark Club,
Mhm.
there are all of the kids talk about how they don't like that our school district is so focused primarily on sports culture, 4-H, like it's always the same things, and all the kids that don't necessarily fit into those bubbles are the ones that usually end up in a different route, and they are really excited to find ways to include other people outside of those factors.
Like
Yeah,
arts and stuff.
Yeah, like the dramas and the arts and the cultural, like just trying to pull in people that are interested in other areas outside of those normal big Crook County focuses.
Our church, they're doing like one of the guys used to be an art teacher, he's been teaching art, and it's amazing the whole myriad of ages that go there.
I've also been seeing there's been more posting on Facebook anyway about some teen stuff at the library. Oh, you should that.
I think of kids club too as kind of a preventative measure.
There's some great parks.
Yeah.
And trails.
Yeah.
What kids clubs do you think? The club that we have at elementary is just like the after school.
Yeah.
Parents pay for them to go there, but it's more like a
Daycare.
daycare, yeah.
Yeah, but I think of it more as like instead of a kid having to go home to nothing, they like at least have a place to go that has some structure.
Building relationships with
Yeah.
people,
Yeah.
Not enough.
not being at home by themselves or with an older sibling doing something they
Yeah.
shouldn't do, or
I mean, that's.
you can't control all of it.
I think that quite a bit of what we just talked about in prevention and recovery, acknowledging that we don't have everything up here for any of these, it's a great start. A lot of what we talked about in prevention and recovery applies to social drivers, but is there anything we're missing that's being done around social drivers?
Have we captured the work being done by Crook County on the Move?
No, we have not, but we should. The work being done by Crook County on the Move. I think just all the classes that they do that hit different age groups. I think there could be better marketing to hit different age groups, but what? Sorry, just kidding.
I think one of the social drivers things that I would say is like, community or togetherness for like older populations. Aging population.
Online call or online.
Yeah.
Yeah,
Mhm.
Yeah,
that's good social.
there's one for older people specifically. There's one for agriculture people specifically.
And teens.
And I
Yeah,
think
all four. I have, they're all four.
Oh, sorry. Think affordable groceries.
Wasn't Shauna Holland when she was here talking about there was a garden thing you guys could do, that people can do garden, but nobody was really doing it, but it is accessible, so maybe.
So we just maybe need to, that would be a problem solver, but we can do something about that.
I'm
maybe.
not to.
I know.
There are things, there's some infrastructure that exists.
There we go. with
Yeah,
infrastructure
a
that's
community
already
garden, yeah.
And this actually might go up to access to care, but childcare or lack thereof.
I think that we talked about it being in all of them.
Either section.
So what exists in childcare?
Kids club.
Kids
There's
club.
we have at our school. I think, I haven't figured out what it is or not, but Barnes View. We have like winter groups and like spring groups, so like
Mhm.
after school they'll have clubs. So they'll do like board games, chess,
Basketball,
basketball,
running.
dance.
Yeah.
We do a lot of different ones, and I mean, they are always to the top full.
Yeah.
Like, we can't keep enough, so those are things that they definitely enjoy doing.
Yeah.
We do have Head Start. We do have, what is the childcare that started it over by the high school?
Oh, yeah.
Over
It's
by
the Early Learning Centers of Central Oregon, and
Okay.
Katie Ellis is running it. But so we have a kiddo there. It is the most expensive preschool in town that I'm aware of. But it provides the most inclusive care hours,
Mhm.
which is important. Like, we've tested out many of them, and there are only a few that actually capture the ability to drop off and pick up outside of the 8 to 5.
That
The other one for social drivers, I think, is a language area. Or you have access to care.
So is there something happening around that we can access? Or we can use? For the virtual? I don't see anything.
They like some of the churches and stuff and advertise the opportunity for them to like. The Catholic Church has a Spanish service, you went there, because I know that, and boy, how do you guys wanna come more? You will. He is really motivated. The problem is finding volunteers that have to do Spanish, English, they're willing to go and help.
I put RHC, and sorry, that's an acronym. I wanted to share that there are things that are happening around housing. RHC is the Regional Housing Council that is convened by Central Oregon Intergovernmental Council. So we have a county commissioner that sits on that. I sit on it not as a voting member, but as a someone who informs or asks questions and represents Crook County. So they have a focus on legislative work around housing access. So, that's one of those issues that along with transportation, gets identified in almost every plan is housing and affordability. So there's something that exists. Okay, last call for resources or things that are already happening in our community for any of these.
mean, I feel like that's something that is unique about our community. We do have so many different groups, right? Like I just think back to the roundup and it's like, what's going on and how many different groups. We do have a lot of people focused on building community. It's just maybe a lot of efforts in different ways and lots of little subgroups.
And not everyone in the community knows about all of the groups
Yeah.
and all of the ways that they're being advertised.
Right.
It's very, it's on top of it.
Mm-hmm.
After post-COVID, when everybody got really comfortable at home,
Mm-hmm.
and I love being home.
Yeah.
Like I wanted to start a parents, because fed.
Achievable.
You know, living right on social media, like a media that they could come in, you know, just be, and maybe we could give them some help, some things, especially around IEPs. and things like
Relevant.
that, but trying to find a place, trying to find a time, it was just, no way, they wanted you to.
And time bound.
You know, but then trying to find where we have it, it was just,
Space is an issue.
it's really, that's why we need the community center so bad, we can have
Yeah.
a lot more clubs and things too.
Yeah.
I have one more thing to add if we have time.
Yeah.
I know there's a couple of like mom/caregiver champions that are starting support groups for families who have kids who are autistic. And then also there's another one floating around of families who have children with disabilities.
Mm-hmm.
Some are good ones. It's having a resource.
Mm-hmm.
Doing that well, but
They don't all like Band of Brothers.
that's just all
I know, me too.
Okay. I think, we are going to want to, okay, so for each of those three, access to care, prevention, recovery, social drivers, we needed a SMART objective. So something that we are going to do to help with issues related to access to care. So this is part of like, we've talked about what exists. We have touched on things that are still issues. So this is where we're getting into some problem solving, right? So, let's start with access to care because we have identified transportation as an issue, and we've identified access to mental health that is more than our highest acuity folks that our CMHP can take. And we can have more than one. We can have one, or we can have one or two. Really specific, because we're trying to make it achievable and realistic for us to actually do.
Yeah, three.
So we're gonna want to hone in on an issue or two related to access to care that we as the Community Health Advisory Council actually have the ability to influence. I'll start by asking around transportation, because that is one across all the plans. Is transportation, we don't have to get into the nitty-gritty about all the details of what works or doesn't work. Is transportation something the Community Health Advisory Council wants to and can address? Thoughts?
I don't know. I think that it seems like that one is being addressed by multiple agencies, and so I almost feel like that one is moving more than the second option, which is the access to the mid to lower mental health activity.
Devin also has her hand up.
Devin, go ahead.
I was just gonna say too that like looking at the St. Charles Community Health Needs Assessment, it doesn't look like transportation was a huge barrier. I mean, definitely a barrier, but not a huge barrier for people accessing care. There were other things that were a little more pertinent.
Okay.
They're closing a different tune to that, but that's just because of our patients population. I will say we did do a assessment to see what we're spending our money, why people are leaving, and it's for specialty appointments. So St. Charles wants to house more of their specialty providers in Prineville. It'll help with the transportation issue. Sorry, gotta do a little flutter here, son. It will help with that.
Well, I was gonna say, we didn't even have specialty providers up there, which I know we did talk about in the last meeting. Is that maybe a focus that we want to prioritize over transportation?
Or are we prioritizing any of these?
Yeah.
I mean.
Yeah.
Yeah, specialty providers, transportation, and mental healthcare access for specific acuity. Is there another issue that rises to the surface around access to care?
Can I speak on that just a little bit of what I'm running into?
Yeah, Rita, go ahead.
So I'm finding when I'm trying to schedule clients with their prenatal care, we're having really limited availability in Prineville. So transportation does become the barrier because no matter what, they have to do their initial OB visit in Redmond or Bend. And then the other issue is, like, if somebody assumes that maybe their water broke or they're in preterm labor and they call their OB, they are advised to go to St. Charles and Bend and not go to Prineville Emergency because they'll just put them on an ambulance and that's costly. And so then people may be deciding, oh, that's too much work, I'm not going to go. And just recently, last week, like I had a client that I needed to schedule her out due to transportation for 5 visits. And out of those 5 visits, I got her 1 appointment in Prineville. So right now I'm working on her transportation to get her to Redmond. So the OB care is really, is very slim here in Prineville.
I think that, in my personal opinion, kind of to what I think it was Stephanie was saying, transportation is on every other organization's list for the next 3 to 5 years, and there's going to be a lot being done. I think it would be better use of our time to focus more specifically on Crook County because a lot of those are regional. St. Charles is regional, COHC is regional, and it's trying to get transportation between tri-counties. If we focus on specialty providers for our county, less people would need transportation out of our county on a regular basis. So I
Yeah,
think
that's what
that
I'm
would be
saying.
something I would prefer us prioritize in this work plan.
Yeah, I hear you, Rita.
Yeah, just going off what you said,
I'm just
Rita, yeah.
looping back to like if we did have more specialty care around OB here, then the transportation wouldn't be such an issue.
Exactly. So if that's something we can focus on, I think that would be a good use of our time and efforts.
I mean, Burns, it's John Day, they get better care, specialty care than we do. I don't know, because we're lumped in.
Mhm.
It's because of how they divided us up.
And then who else? Devin said just more providers, especially for mental health and for lower acuity. Angela said she agrees, Alex, we need more providers for everything, it sounds like.
So then what's the root cause of that? Because one thing I think of, I am wanting to expand because I need more therapists because I am one person. Well, now kind of 2-ish, but not me. I have another employee.
Okay.
I didn't multiply.
That's I was like, how did you do it?
If I can figure out, I'll let you know. But I think of like myself, I need space and I don't have anywhere to house other therapists. So I don't know what everybody else runs into for like having specialty people. I don't know I don't know.
Well, I also think with the perinatal care, we once had perinatal care in Prineville, so what was the driver for it to leave? And so I think that could, like, figuring out that root cause is really important too.
When they shifted the whole birthing unit, that took a
Yeah.
lot of the whole birthing thing, prenatal everything away from here.
Yeah.
So they took all, you know. the
Well,
whole-
that was when
the
St.
medical
Charles
area
took
out.
everything over and then they slowly had to close clinics down, like even Redmond.
Well, I have lady 3 more months.
But I think it could even be as simple as sometimes, I think this is also problem solving, but maybe as we think about forming an objective to make it more measurable and achievable is maybe in this 3-year period, we're not trying to figure out how to bring specific individuals for each specialty here, but working with what already exists in Bend or even OHSU to have the mobile clinics or have one of each specialty provider from Bend come here even twice a month, right? Like it's something that we can try to have that happen with what already exists. Because I know OHSU goes out to Burns, goes out to John Day, they go out to the reservation in Warm Springs. So it's just, can we work with the partners we already have to provide some treatment in Kirk County so that our people don't have to travel elsewhere?
And specialty providers are more expensive. You know, you're trying to get people in those specialty areas, they're gonna be more expensive.
And usually paid less than they would make in bigger areas also.
I was gonna say, and then you come back around to like making it like enticing to live here, be part of the community, which would
Yeah.
cycle.
Okay.
And we,
Yeah, bring us back.
Angela said, I like that idea, and Devin said yes.
Okay, so I'm hearing that we could make a SMART objective around specialty providers. And we might not get there today. Disclaimer also. We're not gonna get there today. Just kidding. I think diving into that why will help us make a goal, right? Because it's a little easier to make a goal about making sure that we're finding options for space for providers to be here than actually recruiting the providers themselves, right? So is there why? I think that's why we asked a question, why no OB? And we can find that out because maybe we can build a goal around, like, if we can figure out that why. That could unearth something that's actually actionable. Are there other whys?
I think we've already kind of talked about some of them. Hope got to it. I mean, it's costs us more money to hire specialty providers. We have to make Crook County appealing to specialty providers. Specialty providers are going to make less money working in Crook County than they will working in Bend or Portland or anywhere else.
Expensive.
And just like we've talked about in the past is housing for specialty providers. I think there's so many whys we've talked about in the past. And
Open 2 exam rooms, 2 days a week, yeah.
right, but that's where instead of trying to say, let's do what we can to figure out how to house these people, pay these people, and provide for these people and appeal to these people to get them here. And instead of doing that, let's work with the partners we already have and see if we can work something out where we can get these specialty providers to our county a day a week, a few days a month, and then see how that goes for a period and then progress from there. Someone.
What are you saying?
Well, just for like, you know, orthodontists and things like that, when they would come, they'd come for, you know, brace people from Bend, they would come and like once a week or whatever, they schedule their private people. But at least they came, you know, here to one spot to do it. So if they had a place that they, you know, we could maybe get some of those things.
Angela also just said her eventual goal is to have a mobile van to go out to Paulina, Juniper Canyon, and Post if we could come up with a community plan, maybe multiple providers, including behavioral, medical, dental, etc., they could all make a trip together in that mobile van to do as much as we can. Everyone's shaking their heads, Angela.
Shaking yes.
Yeah, a good shake.
I know. So the Community Health Advisory Council in our last work plan did have, we had a little bit more of a specific bucket around access to care is really big. And so we had a staffing bucket for providers and for care. So we have a little bit of a foundation for those conversations. I like the framing that you all are talking about is, can we as a community, because that's the definition of Community Health Advisory Council, maybe dive into, and this is where we would get, after we get an objective, we'll dive into activities. So an activity example might be looking at who our partners that, well, what is our need for specialty? Rita said OB, what else?
I never knew how to graph with mosaics.
Perfect.
Time some data.
So what are we needing? And then, so that assessment could be an activity. And then based on the need, who are partners who might be able to fill that need? And then we talk about space, we talk about recruitment campaigns. I think different, like Mosaic and St. Charles and folks have recruitment efforts. There's funding and initiatives around it. We used to have a community provider recruitment group, like support group, that were the ones who showed up to dinner with the provider that was being interviewed and talked about 4-H and how great the schools are, and we'll help you figure out housing and things like that, where there was like more of a, we're going to sell you our community more than anything.
Yeah, where'd you go?
Yeah, right?
Missed you.
Yeah.
We have 4 minutes.
I don't think
We have 4 minutes.
Do we want to talk about maybe meeting one more time in May?
Okay, here's where we're at. 4 minutes. And we don't have any SMART objectives.
And we're supposed to have 3 to 6.
We did decide on these buckets. What I'm wondering is if we need another meeting. Very on like, what are the issues and how can we make an objective to address those? We were successful in narrowing down to 3 buckets, so I count that a win. I think we probably are in a space where we're going to need to send out an invite and have another meeting in May. So the appointed members have a regular meeting in June, the first week in June. So we would need to meet before then. I think we as staff can commit to doing some background work, kind of like we did, of let's compile and maybe weed out some of the noise, the things that are a little more overwhelming, and move in the direction of these buckets. We'll do some prep work for everyone, and what are we thinking about availability for another meeting?
Everyone online, Devin said yes.
And is there homework we could do in between that might help that meeting along? We can think on that too.
I had a suggestion.
Let's hear it.
What if we all do go through access of care, prevention, recovery, and social drivers and identify 2 areas and try to make the own SMART goal? Is that too much? That might be too much. You don't have to, but you could if you want.
Y'all know where we're going. So if you want to get a jump on it and identify a couple issues in each of these categories: access to care, prevention, recovery, social drivers, we could dive into that and
We will never
and
say
draft.
no.
Yeah, and we will do the same.
And I will say this too, if any of you do want to do any of that homework and kind of break up the access to care, prevention and recovery, social drivers, and find two kind of areas we want to focus on, if you want to email it to me before the next meeting so that I can kind of include it in putting together what we'll present to you so it's a more concise version again, that would be super helpful. If not, just bring it to the meeting and we can talk about it. That's okay.
Building your special ed, I felt that. Yeah. Oh, I think that's great.
Well, I mean, that is
That is part of it, Liddell.
definitely part of it.
That's part of it.
I used to know, like, the Central Oregon Disabilities Support Network and then try to get an office in Prineville because they knew we needed it. They couldn't find a rental space that they could even find to just have a tiny little area for one person to be in. They couldn't find it, you know, so that's one thing that kept coming to me was, you know, space and probably the money that they allocated to it too.
How does 2 weeks feel? Meeting again in 2 weeks. Okay.
So you guys are okay with meeting sooner than later?
Yeah. Yeah.
Hold on, let me look. We don't want it to be 2 months from now when we all totally forget everything.
Like on the 16th,
Let me pull up a calendar real quick.
I would advocate not the 23rd because that's spring break.
We will make
So we'll meet
sure,
before spring
we will make sure it is not spring break.
We're gonna dig, we're gonna send out some options.
Yeah.
In 2 weeks, so keep an eye out on your emails.
We'll try to aim for a Monday because I think we know that seems to work for most people. And we will not do it for spring break, everyone, so don't worry. Okay.
Thank you, everyone online. We appreciate you. I know it's hard to get overly plugged into the conversation, but thanks for being here and contributing what you can. Everyone, grab a snack on your way out if you're in the room,
Please.
and we'll see you in a couple weeks.
Thank you, guys. Thank you, Greg.